Hi everyone, my name is Dr. Christina Lindenmeyer. I am a transplant hepatologist and the co-director of Cleveland Clinic's Medical Intensive Liver Unit here in Cleveland, Ohio, and I'd like to welcome you to the Liver Walk. I am one of the American Liver Foundation Heartland Division's Medical Advisory Committee members, and I'm here to talk to you a little bit about COVID-19. I understand that we have some questions to walk through, and I'd like to remind everyone that we do have a COVID-19 resource center on liverfoundation.org, and if you have any questions, you can always contact us via social media or even contact us directly to submit questions, and we can get back with you. So we'll start with some of our questions here. Is it currently safe in Ohio for liver patients or transplant recipients to physically go in for blood work or in-person follow-up appointments? Yes, it is, if medically necessary. And this conversation should always be had with you and your physician about when it's appropriate to seek medical care and when it's appropriate to pursue elective testing. Currently, the stay-at-home order in Ohio has been lifted and our hospital systems are operating like business as usual. Most hospital systems, or I would say all hospital systems, have taken precautions to make it as safe as possible for patients to be able to seek the medical care that we need. We don't want you to delay testing that you need to have done. Laboratories, imaging departments, endoscopy units, and office visits have all taken steps to make sure that patients can maintain adequate social distancing. We have hand sanitizer available for patients and also masks. So yes, it is safe under safe precautions. The next question. What current information do you have about the safety of existing and potential COVID-19 treatments for liver patients? This is an excellent question, and we don't know a lot about this yet. There is no current widely FDA-approved therapy for COVID-19. Multiple medications are currently in clinical trials, and we do offer some of these as part of the Cleveland Clinic health system. None of these treatments are specifically approved for liver patients. They're being widely tested, and these are observational studies where we observe how patients respond to treatment and also observe the safety of these medications and potential side effects or adverse events that can happen when on medications. To my knowledge, to this date, there are no significant adverse events associated with any of these medications, but we certainly learn more on a daily basis. Many patients with ascites have a history of esophageal varices. Is this a problem if we need intubation? Excellent question. So esophageal varices are veins that form as part of the high pressure system in the liver that occurs because of chronic liver disease. These veins form to help decompress that high pressure system, and they form in the esophagus or the food tube, which is kind of a straight shot up the chest right back to the heart so that blood can get back to the heart and continue to circulate appropriately. The esophagus or the food tube is a completely separate tube than your air tube or your trachea. This is where a physician would place a breathing tube should you need to be intubated, should you get COVID-19. So these are totally different anatomical structures, different locations in the body, and esophageal varices should not pose a problem if you need to be intubated. Many patients with ascites, some drugs are being investigated to treat COVID-19 patients. Do you know if these could be an option for patients with decompensated cirrhosis or other liver damage? Again, I think we don't know enough yet about this question to give you a good answer. We're learning more every day about the medications that we have available. Some of the medications that are being tested in clinical trials actually exclude patients with decompensated liver disease and may exclude patients with abnormal liver numbers because the medications may themselves cause a small amount of drug-induced liver injury or cause abnormal liver numbers. So giving them to patients who already have pre-existing liver disease may confound or cloud the results of the study. Certain liver patients are being enrolled, but the inclusion criteria are changing on an almost weekly basis. So I think that we'll certainly know and more in the weeks and months to come as we test these therapies and even as we develop new therapies to treat COVID-19. Since COVID-19, hospital patients are isolated and many liver patients already have hepatic encephalopathy. Do you recommend any additional steps we can take now to make sure the medical team has the necessary patient history information should we be hospitalized? If you recommend that we create a written background sheet, what information would be useful to include? Absolutely, I think this is the most important question. It is always a good idea to be prepared in the case of an emergency, especially a medical emergency, and especially for patients with hepatic encephalopathy. I recommend keeping a sheet at home that has your current list of medications, the doses of medications, and when you take them. Also of critical importance is to have conversations with your families now and document what your wishes would be if you were to develop a critical illness. This is called an advanced directive, or identifying a healthcare power of attorney who can help make decisions for you if you're unable to make decisions because you're sick. It's important to define what your wishes are now so that if you're not able to speak for yourself, either due to hepatic encephalopathy or critical illness, that your wishes can be made very clearly known to your healthcare team. So I recommend, in summary, having a sheet at home of your medications, an advanced directive, and identifying a healthcare power of attorney, in addition to keeping your important documents available in terms of what your medical history are, so that we can provide this to your medical team and get you the best medical care possible. So again, my name is Dr. Christina Lindenmeyer, and I'm happy to answer any questions you have about COVID-19. We do have a COVID-19 resource center on liverfoundation.org. You can always contact the American Liver Foundation staff either by social media or to contact us directly, and we'll help to get your questions answered. I hope you have a great Liver Walk week, and thank you for watching.